On March 23rd, all non-essential businesses across the state were forced to close to prevent the transmission of COVID-19. We know this hasn't been easy, and that many businesses, large and small, across our communities have suffered as a result. And we're anxious to try to get everybody back up and going as soon as it makes sense. The goal of the reopening plan is to methodically allow certain businesses, services, and activities to resume while protecting public health and limiting a possible resurgence of new COVID-19 cases. To that end, Massachusetts will follow what we're calling a four-phased approach. Phase one is what we're calling START. Here we're looking at industries that are more naturally set up to have little face-to-face interactions and workplaces that are better able to manage face-to-face customer interactions with certain conditions. Phase two is called cautious. We plan to have more industries with more face-to-face interactions resume operations, again with conditions. Phase three is going to be called vigilant, where we can allow for loosening of some of the restrictions from some of the earlier phases if, in fact, the public health data continues to conform to the terms that we're all pursuing as we look at that going forward. And all three phases will depend, as I said, on the prevalence of the virus and especially on the conditions in our hospitals. And phase four would be what we would just call the new normal. We all know life will be different, but as the medical and life science communities make progress in developing treatments or vaccines, we can really begin to put this virus into the rearview mirror. But none of that is going to happen overnight. We'll continue to follow the data and the public health metrics to determine when phase one start of reopening begins and then when it's safe to move on to concurrent phases after that. The goal is to begin this process around May 18th, but it will be gradual and the facts on the ground will obviously determine whether we actually hit that goal. But keep in mind, this is a disease we're still learning about across the globe. We've been one of the hardest hit states with almost 5,000 deaths and nearly 78,000 confirmed cases. That means we have to be flexible and honest about the fact that the timing and the details of these phases could change depending upon the track the virus takes as we go forward. If public health metrics indicate that a particular sector or industry is unexpectedly susceptible to spread, then that specific industry's reopening may be delayed to a later date. We'll also have to revisit our reopening approach if at any given time there's evidence of widespread community transmission or an unexpected new spike in cases, because we will not only continue to test, but significantly enhance our testing capability as we go forward. Obviously, we hope that none of these setbacks occur. But as we've seen around the globe, there are no guarantees when it comes to dealing with COVID. And our ability to move forward through these phases depends almost entirely on everybody playing their roles. Face covering, staying at home when you feel sick, washing your hands, using hand sanitizer, staying 6 feet away from others whenever possible, and how well everybody else does these things and others will determine how we move forward and how successful we are. People here have done a tremendous job under some very difficult decisions and circumstances, and we have, in fact, flattened the curve. But to keep moving forward, everybody must continue to keep it up. We'll have additional information in the coming days about which industries and activities will open in each phase based on the trajectory of the public health data. It's incredibly difficult to plan for a future while we don't really have real certainties about how this particular virus moves and relates and acts across time. We'll also continue to work with our neighboring states to collaborate on the reopening strategy. As a small New England state, it's important to remember that we exchange information and ideas with other eastern states to be consistent and unified wherever it makes sense. Members of the governor's office and our strategies and plans as well. These last couple of months have obviously been painful and difficult and frustrating for us all. But as I said, we are seeing positive signs that the work everybody has done has been paying off, and that makes it possible for us to be serious about a phased reopening.